In July of this year, a shocking act of violence overwhelmed New York City. The man named Tamara drove from Las Vegas all the way to Manhattan during the evening rush hour. He entered a high-rise at 345 Park Avenue, armed with a M4 assault rifle. Within minutes, he had taken the lives of 4 people: Blackstone executive Wesley LePartner, building security guard Aland Atini, NYPD officer Didarul Islam, and a 27-year-old employee named Julia Hyman. In his wallet, police found what appeared to be a note claiming he had CTE, chronic traumatic encephalopathy. He blamed NFL for hiding the long-term brain damage caused by playing football and requested that his brain be studied during autopsy. But there is the twist. Tamara never had played in the NFL. He had only played football in high school. Was this an excuse or a cry for help that we failed to hear? Today we take a hard look at what CTE is and how it affects not just the brain, but the body, mind, and soul. Using the ACES model of health, anatomy, chemistry, energy, and soul, we will explore how brain trauma can ripple through a person's entire being and what we can do to heal it. What is CTE? CTE is a progressive brain disease caused by repeated head trauma, seen in contact sport athletes, military veterans, abuse survivors. Symptoms include memory loss, rage, anxiety, depression, impulsivity, suicidal behavior. When I was studying in the mental health center in Shanghai, I analyzed and published 81 cases of CTE and found these symptoms are exactly like what we're describing here. Currently, definitive diagnosis is only possible post-mortem. But we know now that CTE is not just a brain condition, it's a full person injury. It affects how we think, feel, connect, and live. Let's look at it through our lenses of ACES. First is anatomy. Every head injury, no matter how minor, can damage delicate brain tissue. Microbleeds, axonal shearing, inflammation. Repeated impacts leads to tau protein tangles like sticky webs disrupting neural signals. Over time, atrophy in key areas like front lobe affecting judgment and emotion, hippocampus affecting memory, amygdala affecting the threat response. What helps? Craniosacral therapy, cervical alignment, functional neurology, acupuncture for cranial pressure regulation. Think of your brain as a house. Even if the walls look intact, the wiring and the plumbing may be crumbling inside. The second dimension is chemistry, and in CTE, the brain is on fire. Chronic neuroinflammations activate glial cells, cytokines, and oxidative stress. Compromised blood-brain barriers allow toxins come into the brain. Gut-brain axis also affected. Leaky gut often mirrors leaky brain. Supportive therapies like omega-3 fatty acids, curcumin, glutathione, B vitamins, IV nutrient therapy, anti-inflammatory diet, low sugar, high polyphenols. The brain is a chemical factory, and when the balance is off, the entire system goes haywire. Actually, it's more than just that. A lot of people have an epigenetic condition like a cryptopyrrole disorder, missing B6 and zinc in the brain, also having insufficient methylation, having deficient serotonin and dopamine function to begin with, and poor ability to reduce oxidative stress and inflammation. For these folks, and this change will make 10 times, 100 times worse for them, make their negative personality traits and psychopathology 10 times worse. The third lens is energy or electrical rhythm and the flow. Head trauma can disturb brainwave activities, vagal tone, nervous system regulation, heart-brain coherence. From a Chinese medicine perspective, it causes qi and blood stagnations. It disturbs the chief consciousness or spirit. The emotions become volatile, sleep disrupted, sensitivity heightened. So the tools to restore the energy include the neurobiofeedback, navigated TMS, meaning the guided by quantitative EEG, and we do both of them in Young Institute of Integrative Medicine, and also low-level light therapy, acupuncture, meridian balancing, breath work, qigong exercise, HRV training. Anyway, so the CTE patients often say, I don't feel like myself. That's because their inner frequency is no longer in tune. The most painful and least discussed aspects of CTE is a spiritual toll. Many sufferers lose their sense of self. They feel ashamed, confused, disconnected from others, and from who they used to be. Because they have no control of their brain and no control of their behavior, they very often feel shamed by themselves and feel resented by their relatives. Soul restoration should include journaling, reflection, guided forgiveness, spiritual mentorship or faith-based support, group sharing, identity work, 12 steps program. When someone says, I don't recognize the person I have become, they're not exaggerating. Their soul is wounded, and no MRI can detect that. So here's the summary of ACES pathway to healing. Anatomy, realign the brain-body structure. Chemistry, quench the fire of inflammation. Energy, reconnect the rhythm of life. And soul, restore meaning, identity, and peace. Healing CTE isn't about returning to who you were. It's about reclaiming your wholeness, physically, emotionally, energetically, and spiritually. One of my patients, a former boxer in his 30s, came to me depressed, angry, and afraid of himself. His family was falling apart. He thought he was broken forever. We began with structural therapy and acupuncture to relieve pressure. Then we used anti-inflammatory advanced nutrient therapy and neurobiofeedback and QEEG navigated TMS and daily breathing training. He started journaling and reconnecting with his faith. 3 months later, he told me, I still have bad days, but now I know I'm not lost. I have tools, I have hope. CTE is not just a brain injury, it's a whole person trauma, and it needs a whole person response. With the ACES model, we don't just treat symptoms, we treat the story. If this episode resonated with you, share it with someone who needs to hear it, subscribe to the podcast, and leave a review. Visit aceswell.com to learn more about our programs and retreats. You're not your diagnosis. You are not your trauma. You are a human being capable of healing in every dimension. This is Dr. J.D. Young, and you have been listening to the ACES Health Podcast. Stay aligned, stay conscious, stay whole. We'll see you next time.